Hello friends, I am Dr. Ankit Sharma, Consultant Urologist at Manipal Hospital Kharadi, and I am here to talk to you about benign prostatic enlargement. Benign prostatic enlargement is an age-related process whereby the prostate enlarges as men age, and they lead to some symptoms which are known as lower urinary tract symptoms. These symptoms can incorporate from frequency of urination to urgency, sometimes even leak of urine before reaching the bathroom, nighttime wakings for urination, a weak or a thin stream of urination, interruption or intermittency of the stream of urine, and incomplete emptying after passing urine. All these symptoms are together called lower urinary tract symptoms, and around 60 to 70% of men over the age of 60 years will suffer from these symptoms. But even though the population is suffering from these symptoms, why are they not approaching proper channels? Because there is a lot of misinformation in the media, and which is why I am having this talk to clear some doubts. Firstly, this is not a acceptable part of aging, as majority of men in our society believe that once they cross a certain threshold of age that they have to live with these urinary symptoms, and that is how life will be. These are completely remediable things which can improve the quality of life of the patient. The second thing which we see most commonly is that the patients do not reach a proper care. They do not know who to approach. So in case you or your relatives do have symptoms like these, the proper channel of approach is to a urologist or a genitourinary surgeon, because this is our field of specialty. Men are also worried that these things, these procedures or these medications will lead to some form of sexual dysfunction, and they will not be able to have an active sex life post these treatments, which is also false. The only thing that is affected by these medications or these procedures is ejaculation, the sensation, the act, everything remains the same. However, some men experience more retrograde ejaculation than others, which might be the case. But even for men who are wanting to have children post the procedure, there are now certain procedures like Urolift and Resume which are available in the market, with which we can even preserve ejaculation and make sure that the patients can bear children post the procedure also. There is also a lot of fear or talk in the media about how these procedures are morbid procedures, and they are a lot of dreaded complications which tend to occur. So these are all erstwhile procedures which had certain complications and which got a bad rap, but nowadays, because of refinement in the technique of the procedures, newer technique availabilities, all these things are not as common. Majority of these men will lead a normal life the way they were leading before the procedure, just without urinary symptoms post the procedure. There is also a lot of fear that even despite the procedure, the symptoms will not be relieved, or that the procedure will be required again, or more than one procedure will be required to relieve the patient of symptoms, which is also not the case, because these procedures are generally very durable procedures. In good hands, good procedures will lead to recurrence of only around 8 to 12% at 20 years post the procedure. So the durability of the procedure for 90 to 95% of men is over 20 years. Certain procedures like Urolift will require a reprocedure in around 20 to 25% patients at 10 years, but even the 10-year span is generally uneventful and without any issues. There is also fear that once these procedures are performed, the symptoms will not be relieved. There are certain symptoms which are not relieved generally if the patient approaches us at an end stage, and those things are something which is not related to the procedure per se, but related to the time at which the patient has approached us. If you approach early and if you remediate early, there is almost 100% satisfaction both from the patient side for the symptoms as well as for the procedure durability. I hope this was informative for all of these issues. If you or if any of your relatives or parents suffer from any of these symptoms, please feel free to reach out to us, and we will be able to provide them some form of solution. Thank you.